Dr. Jennifer Mathieu. Good morning, doctor.
Good morning, Shane. Thanks for having me on this morning.
Well, thank you for calling me. It's a pivotal time in history, not only here in Hawaii, in Maui, but around the world with this pandemic and a lot of concerns and questions.
For sure. I know COVID just continues to be on our minds, and specific to me, I mean, having a baby is one of the mom's biggest moments in her life, and she just wants everything to be perfect and safe. She wants to bring home that healthy newborn.
Yes, exactly. And we want her to do so, right?
Absolutely.
All right, Dr. Mathieu, I have a few questions. Let's start with this one. This question comes and says, I am due in 3 weeks. Do I need to have a COVID test before I come in, or how does that work if I don't necessarily know when I will go into labor?
Well, Shane, it's important for every mom, of course, to be prepared before she's going to the hospital to have her baby, but thankfully, COVID testing is the one thing she doesn't need to worry about. Her provider is going to take care of it. So, for our mothers that have scheduled procedures like labor inductions or cesarean deliveries, her OBGYN provider is going to schedule the COVID test for her within 72 hours prior to going to the hospital. A lot of cases, it will be done right in the provider's office. But if not, they're going to schedule it with one of the nearby primary care offices, so it'll be taken care of.
Awesome.
The rest of the mothers that come in unscheduled for labor, once the decision's been made, she's going to be admitted. The nurse on labor and delivery is going to do that COVID swab. So our moms don't need to fear that COVID testing is going to delay their admission or transfer to the labor unit. They're going to get the same high standard care that we expect at Maui Memorial every day. The test takes about 3 hours, so we'll have the information on the same day of admission, and we can adjust any care then as needed. And while waiting for the test result, each mother is still treated based on symptoms. So if there's fever or cough, anything like that, we'll make sure that she's appropriately cared for. And lastly, all of our labor rooms are private rooms. So again, while we're waiting for any testing, all our moms are safe.
Awesome. Well, how do I know if I'll be safe in the labor and delivery unit if you happen to have a COVID positive mom in there at the same time, or even a positive in another unit in the hospital? How do I know I'll be safe there?
Sure. And that's on the minds of not just our patients, but honestly all our providers and nursing staff. So for starters, our labor and delivery and postpartum units are each closed units. So that means there's no flow through from other places in the hospital. And the two units are right next to each other, so we don't have to travel far if you're going from your delivery over to the postpartum unit. As well, labor and delivery has its own OR, so for a patient who's needing a cesarean delivery for any reason, again, she doesn't have to travel outside that safe unit. Our nurses rarely float to other areas in the hospital where there might be COVID patients, so they're being protected and kept safe. And for postpartum care, our babies are now having nearly all of their care right there in the room with mom and her support person. So this avoids the babies having to be together in the nursery and potentially contaminating. Wow. Each patient, support person, and nurse are wearing masks. There's protocol to wear additional appropriate protective equipment if we have a possible COVID patient. And as I discussed previously, we are testing each mother for COVID. Their support person doesn't have to have a COVID test, but they're going to have a temperature and symptom check upon entry to the hospital, and they'll have temperature checks throughout the stay. In the case that we do have a patient that does test positive or is considered to possibly have COVID based on their symptoms, we have 3 dedicated rooms that is in a separate alcove quarantined off on the postpartum unit. And there's HEPA filter in there, so they can stay in there for labor, delivery, and postpartum. And they're going to have their own dedicated nurse who is not taking care of any other patients, so that will help us protect moms from spread of COVID in our facility. And finally, with each mom and baby, we're discharging the couplet as quickly as we can in a safe manner, again, avoiding them having to be in the hospital for a longer time frame.
That is awesome. Dr. Mathieu, one thing I notice about the labor and delivery unit, you guys try and make it as comfortable as possible, and especially now with all of the fears that is behind. And thank you for encouraging and, really setting apart the truth of what's going on at Maui Memorial Medical Center. So thank you, Dr. Mathieu, for that. And one final question. This comes from a soon-to-be concerned mother. She says, does my husband need a negative COVID test in order to be in the delivery room with her?
Sure. And it's a good question. So, no other patients in the hospital routinely have visitors, but we are still allowing our moms to have their support person. So the support person will have their temperature checks during the stay, and they'll be tested for positive symptoms. Any support person, unfortunately, that has a fever or does have symptoms will be asked not to enter the facility, but they do not have to have a COVID test ahead of time or during their stay. And then, each partner with the mom will be wearing their mask throughout the hospital stay as well.
Awesome. That's just some great information and very comforting, too, coming from you, Dr. Mathieu. I want to thank you again, you and the staff there, and hopefully we can talk again on another Thursday. Any last words, doctor, before we leave?
Sure. Well, I just wanted to say for patients out there coming to the hospital, they do have questions, anything that we didn't cover, we now have a fact sheet for you on the website, mauihealth.org/safe. And so there are OBGYN facts and other information there, or you can even submit a specific question. Shane, thank you, and thank KPOA so much for inviting me to the show this morning. It's a true pleasure to be able to answer questions for the community, hopefully alleviate some of these fears and anxieties.
That you have done, my dear. So you have a wonderful 4th of July weekend. We'll talk again.
You too. Aloha.
Aloha.